All right. Well, hello, everyone. I know that we're waiting for a few guys to log in. It's good to see all the participants, everybody coming on board. Nice. We're getting everyone in here. So I just want to welcome everybody to the State of Addiction Treatment 2023. It looks like we still got a few more coming in. So I'm going to give everybody a couple of minutes to log in. But just a little housekeeping while we're waiting for everybody to get here. If you could, if you have any questions for the presenters today, you can put that in the question and answer section down at the bottom, the one that says Q&A. If you have any tech support questions, you can put that for Dave and the team and Jillian in the chat. So please put any tech support in the chat and Q&A for the presenters in the Q&A section. Also, what I like to do is if you can put over in the chat, just so this is a little fun, you can put over there where you're watching from today. That's a lot of fun for us to see, like what what city and state you guys are logging in for. Have some fun with it. I know whenever we started doing this thing, it was really cool to see people from all over the world logging in to watch the information and to hang out. So please put that in the chat. We would absolutely love to see where you're watching from. Okay, so Dave, I'm seeing a couple of people say chat is disabled. Can you take a look at that and see if you can enable the chat? We'll get on that because I want to see where we're watching from. I see Jordan's from Nashville. Good stuff. Good to see you, Jordan. Cool. Jason's here, Cliff's here, Mia's here. Right on. Cool. Oh, there we go. Look at all that, guys. Check that out. That's really cool. It's good to see. Thank y'all for joining us today. All right. Let's see how. Yep, we're getting there with the tennis. All right. I'm gonna go ahead and get things started, and please continue to chat over there. Remember, chat tech support and where you're from in the chat, and questions for the presenters in the Q&A. So hello, everybody. My name is Glenn Hadley. I'm the Senior Vice President of Strategy at Dreamscape Marketing. I'm also the host of Perspective Matters This Week in Behavioral Healthcare. And joining us today on the State of Addiction Treatment 2023 is an esteemed panel of experts in their own right. They've each presented over the last year on trends we've come to realize here as we wrap up Q1 of 2023. I can't believe that we're almost at the end of Q1. It's just flying by. And we're really excited to bring everybody here on one panel today. Also, if you would like to continue the conversation with any of us, I know every one of us gets out and about at certain events throughout the year. I know that we've got like the RX Summit coming up and the NATAP conference is coming up, West Coast, all the symposiums and everything. So I definitely encourage you to continue the conversation there. When we come together as a group like this, it's important that this is the beginning of a good conversation. And we really want to continue it in person throughout the year. So feel free to meet us up at some of these events and talk with us and continue this as we go through the year. All right, cool. So let me introduce our panelists here. I'm going to go through this and try to run through this pretty quick. So first, I want to start off with Dr. Bethany Nelson, the Director of Foundation Operations at the National Association of Addiction Treatment Providers, otherwise known as NATAP. Dr. Nelson serves as the Director of Foundation Operations for the Force within the NATAP team and earned her PhD in sociology from the University of Tennessee, go Vols, where her research focused on criminology, identity, and mass media. Prior to joining the Force team, Dr. Nelson worked for both fundraising and program management for several nonprofits across the Southeast. Cool. Welcome, Bethany. Thanks for being here. Next, we have Christy Cessna, Chief Executive Officer at Integrative Life Network. Christy runs a family of trauma-focused treatment centers in behavioral health and has worked with companies in different growth stages, launching and sustaining capacities of de novo and acquired programs, M&A, and well-established programs. She has worked for several of the industry's most respected private programs and brands, delivering pivotal outcomes. Christy holds a master's degree in counseling psychology, has experience as a practicing clinician, and is a certified DISC trainer. So welcome, Christy. Thanks for being a part of the panel. All right, next we have Michelle Mullany. Michelle is the CEO of Prosperity Behavioral Health, a leading revenue cycle management company and financial services provider for behavioral health facilities. She has spent her career developing and scaling behavioral health services. She worked as System Vice President at Mainline Health and Vice President of Inova Health System, overseeing all mental health and substance use services. Michelle is also a licensed clinical social worker and a Marine Corps veteran. Thank you for your service and glad to be here, Michelle. Cool. Next, we have Dr. Emily Beelan. Dr. Beelan is the Director of Operations for Dreamscape Marketing. Prior to Dreamscape, she was the head of marketing and program management for global industry leaders in behavioral healthcare, setting local and international marketing strategies that merged a company's brand with its commitment to the evolution of engagement-driven service. She designs lead acquisition strategies through digital ecosystems and human capital infrastructure, and provides leadership to individuals and organizations striving for maximum return. Emily holds a doctorate of divinity from the University of Sedona, attended Columbia University School of Social Work, and has a BA in Metropolitan Studies from NYU. So Emily, thanks for being here. Appreciate it. Next, we have Ben Dittman, Senior Vice President of Partnerships at Kipu Health. Ben established Avea Solutions, an industry-leading revenue cycle management software for behavioral health providers, and is now the Senior Vice President of Partnerships at Kipu Health, a top electronic medical records platform, which recently acquired Avea. Before founding Avea, Ben spent 15 years in banking system design and consulting, and is a veteran of this webinar. So thanks for being here, Ben. Appreciate that. Another veteran of this event is Dexter Braff. Dexter is the founder and president of the Braff Group. With 30 plus years of experience representing healthcare service companies, Dexter is recognized as one of the preeminent industry experts in healthcare M&A. Dexter has been the keynote speaker, panelist, or speaker on various issues regarding healthcare mergers and acquisitions or finance at conferences across the country. Dexter holds an MBA from the University of Pittsburgh, a Master of Science from the University of Oregon, a Bachelor of Arts from Cornell University, and received the Vincent W. Lanphier Award for the academic achievement from the University of Pittsburgh. Dexter was inducted into the Home Health and Hospice Financial Manager Association Hall of Fame as Dealmaker Extraordinaire in 2018. Pretty cool. So welcome to the panel again, Dexter. Good to see you.
Thanks.
And finally, we round out our panel today with shareholder and vice chair of Pulcinelli Law Group, Tani Weiner. Tani is a seasoned corporate lawyer with a special focus in behavioral health and specialty healthcare services. He boasts an extensive track record of successfully completed healthcare M&A transactions and regularly partners with equity sponsors and executive leadership in an outside general counsel role. Tani brings his 15 years of experience representing leading behavioral health providers to the discussion today. And thank you for being on the panel again, Tani. Good to see you. I just want to thank everybody for being here. What a cool panel, and I'm excited to jump in. And so I'm going to start off with a newcomer to the panel, Bethany. I want to welcome you and glad to be here today. And we'll start with you because as a representative of NATAP, I just want to kind of ask, like, what does NATAP consider is like the major issues in addiction treatment today, like going into Q2?
Thanks, Glenn. I'm happy to be here. So our conference this year, we're actually going to be focusing on 4 larger issues. We're going to be talking about acuity, equity, workforce, and reimbursements. So in terms of acuity, we know folks are coming for treatment with a lot more acute health conditions than in the prior, and a lot of times because of collective trauma, whether it's been political unrest or the pandemic, people have decreased recovery capital. And we know that's impacting the field in a broad way. Equity, we know that everyone still doesn't have access to quality treatment. For the workforce, all the social conditions recently don't just impact our patients, it impacts providers. So there are issues of keeping up staff morale. There's issues of keeping them really engaged. And of course, there was the distinction with telehealth coming on board, now having issues keeping in-person programs staffed. So that's on the top of our list. And then the issue of reimbursements. We know providers all across the country are providing amazing health care, and they're not being reimbursed at an adequate level. So those are the 4 topics that we're really going to be hitting on this year.
Wonderful. I appreciate that kind of insight. Looking forward to that. And I kind of want to open it up to the group here to ask, like, where are you guys seeing that in your specific areas, and where are you seeing these kind of issues being kind of brought into your areas of focus? And I'll just open it up to the group. Who's going to kick us off? Ben, do you want to start us off?
Sure. So I just like to talk about and thank Bethany and team for the Force project. That's been a amazing addition to this space, and I think one of the things that we've learned through that is, I mean, as we'll talk about more, is I think last year we talked about operationalizing data and how do we use that data to make informative and actionable decisions. I think one of the things that we're probably a theme for this year would be harmonizing data. So it's bringing in data from multiple sources. Everybody wants customized solutions, but that creates an issue when it comes to standardization and reporting. So.
Right on. I definitely see that. It's amazing to see the evolution of reporting and data, and we're going to talk a lot about that as we go through the as we go through the webinar today. Bethany, I want to ask you, like, what's kind of underlying? Like, is there a common theme underlying a lot of this, or is it a combination of multiple themes that's kind of underlying these issues?
So it is a large combination of a lot of factors, but playing off what Ben said, I think the site that we can really start to make a difference, one of the underlying causes that we can collectively solve and work towards a solution together, is going to be in our data. It's going to be in the way we're reporting. It's going to be in the way that we're talking about and engaging with each other, and then outside stakeholders, our patients, their families. So I really think this challenge of measurement at the beginning will help us solve a lot of future challenges down the line, but it sure is a big lift at the beginning. So we're excited, and part of the big challenge is knowing what you're up against. And I think we've reached a point where we can comfortably talk about that. So now we're getting into the really good lifting, working part of it. So measurement is our big issue, but we're on a way to a really great collective solution.
Yeah, I'll tell you, a few years back, I remember being at a conference and seeing there were 3 panelists speaking on outcomes, and it was the first time I'd ever seen that. And I was like, wow, it blew me away. And now it seems like you can't have a virtual webinar or talking with anyone in the industry about it without it coming up. And so Michelle, I'm going to throw it to you on this one. With all this this focus and needs on measurements and outcomes, I'm sure that the payers are adapting their behavior according to this. Like, what are you seeing on that front? And like, does this have anything to do with this new focus on compliance, even playing a role in that?
Yeah, certainly. So, we're still seeing some of the same tactics that have been used before by payers to continue, audits, policy restrictions, things like that. And those are continued being used. And that's really just requiring providers to stay on top of their RCM functions. Furthermore, with payers really trying to figure out, as this evolves, the different ways to evaluate programs in the fields of psychiatry and addiction and mental health in the way that other disciplines of medicine have been evaluated, measuring outcomes and looking at measurement-based care is one of the variables that they're looking at in terms of how they can sort of quantify the outcomes of a program and the quality of a program. Compliance is definitely changing as well. So as we see Joint Commission standards being changed in January, there's now increased difficulty in opening new facilities just due to sheer licensing and zoning restrictions, especially at sort of subacute levels of care. So we're seeing more restrictions in the PHP, IOP, in opening those facilities. And then there's just this all leads to a higher risk of business disruption from various compliance related issues. Ultimately, that's going to lead to higher costs for facilities and treatment providers. And there are ways to mitigate this risk and get ahead of it. But, ultimately looking ahead at what the payers are going to be asking for is a very quickly evolving field of study. And it's just really important that we pay attention to what's on the horizon.
Absolutely. And we're definitely seeing that. It's funny, I was glancing down at the chat and I saw a buddy of mine, Mike Lifshots from Hatch Compliance, jump on, and it's like, seeing more and more organizations like Mike's and coming around because of this increased need and the changing behavior in the market. Before we move too far on from this, just Bethany, I'm going to shoot back to you real quick. Ben mentioned force. Can you talk a little bit about force and how that's kind of playing into this from a high level?
Sure. So for those on the call who might not have heard of FORCE at this point, just a quick rundown. We are the foundation's branch of NAATP, and we work with providers to collect de-identified health data so we can establish trends and provide general reporting, and then site-specific reporting to the agencies that have signed on with us. KIPU is actually a really great partner of ours, and so I'm very excited about all the good work that has happened there. And in terms of compliance, I don't know that our tool does best with that, but what we do try to do is give all of our sites really detailed reporting at the end of the year so they can use it to help elevate themselves in whatever space it might need, whether that's going to be political, whether it's going to be payers, whether it's going to be towards families and participants. We really try to give that kind of detailed data, and then we take and collect everybody's and put it together so we get a larger national picture, so we can start talking about trends across the United States, and we can start looking at what types of things are working for different populations. It does get a little challenging where things are de-identified. There might be some information that we could find really helpful, but we're just not set up to take that at this point. But our first annual report is set to roll out before May. So everybody will be able to get their hands on it and see what that data looks like in action.
I really appreciate that. Whenever I have the opportunity to travel around and speak in other conferences and other verticals, and I talk to them about, our space in addiction treatment. And for a long time, it's I've almost related it to the Wild West, is that it's so different. And you have to kind of be born up in it and come through it to really understand it. And I think that this move towards collecting data and really sharing it at a national level is moving away from that and really points to the maturation of the industry. I'm pretty excited about that. Just the fact that we're all here today and here presenting real information is a move towards that. And I'm excited to be a part of that and part of that movement. Really glad that NATAP is doing the work that they're doing, that you guys are doing in this to centralize the data pool. I'm going to shift gears.
If I can add, the discussion around compliance is near and dear to anybody in mergers and acquisitions, because the number 1, 2, 3, 4, 5 reasons why a deal falls apart at the end of the day is almost always going to be some relationship to compliance. Buyers don't want to take on any kinds of compliance risk. And so there's the due diligence aspect of a deal really digs in very, very deeply into how folks are doing all manner of compliance. And that's just not billing compliance. It's, are all the medical records up to date? Are all the licensures correct? Are all the people have the right credentials? Are they credentialed properly in order to bill for the various different services they have? And any misstep on that creates a lot of concern about exposure and a lot of concern about trust. And it's not necessarily that people are intentionally doing things wrong. More often than not, it's unexpected or something that was missed. But compliance is a huge part of M&A.
I would totally, sorry, Glenn, if I could, and totally agree with that, and the perspective of doing the diligence and handling the legal side of deals, in addition to all the issues that Dexter said, which I completely agree with. There are business practice areas that have evolved over time. And we often, when we're dealing with a transaction, practices come up where there may be assistance with patient travel or housing or, marketing arrangements, or how do you compensate people? And so in addition to the basic block and tackle of your revenue, the cycle and legal platform on which you're providing the services and validating them, there are also things that are done that maybe in the past were okay, but as the field matures, as there's additional scrutiny in it, as there's government reimbursement in it, the legal potential traps that one could fall into are larger, and those ripple back into deals. And there are legitimate challenges in terms of, well, how do we help a patient who isn't able to afford a place to stay, but needs outpatient opioid addiction treatment? If we don't give them any help with housing, then they're not going to get any well. And there are ways to thread those needles, but the regulatory framework has changed over time, and we see that smart providers are paying attention to all those things to make sure they have sustainable, compliant business practices and would withstand, diligence in the course of fine treatment they want to offer their patients.
Yeah,
I'm sorry, go ahead, Ben.
Just from an operational standpoint, the investment in compliance on the front end, cost-wise, is small to having to clean it up on the back end. So, it often seems like it's laborious and an extra effort, but if you do it right the first time, it sure saves you a lot of operational cost on the back end, and then revenue as well.
And legal fees.
And legal fees.
So Tani, hold that thought, because I'm going to come back to you on the legal trends and regulations in just a second. But Dexter, I want to jump back to you for a moment, because one of the things that as the industry continues to mature, I remember whenever compliance and these compliance almost wasn't even a part of these systems at the facility level, and now we're seeing like directors of compliance being installed all across the country. So that is a really big change at the industry level. Talk to me a little bit about valuations, because here's another change that I'm seeing, is that for the first time, I think that I've been involved in the industry, we're seeing like external market factors really impact M&A inside the industry. I've usually, my experience has been, this industry has been almost it's agnostic, like just set over to the side, and the market's doing its thing over here, and we haven't been impacted. But now we're seeing that. What are you seeing?
Yeah, it's a very interesting period of time after just remarkably high valuations in the space without a lot of noise coming from the macro environment. We now have a lot of noise coming from the macro environment. I'm just going to tick off a few, and I'm just very, very briefly. Inflation is significant. It's not only making buyers uncomfortable about the marketplace, but it's literally reducing the amount of earnings that companies have, particularly with increased wages. And so even if the multiples that are being paid for companies remain the same, the amount of earnings are coming down because the wage rates have come up. The cost of debt, which was remarkably cheap prior to last year, has gone up significantly with the Fed increasing their interbank interest rates. And that makes deals more expensive. And as deals become more expensive to come off, valuations are challenged. The war in Ukraine continues to make people just nervous about what's happening in the overall economy. We've had some high-profile stumbles of players in the industry in various different segments of behavioral health that for one reason or another have fallen into some difficult situations. And all of those situations ripple down throughout the marketplace and causes buyers to get a little bit concerned. We already spoke a little bit about the ongoing staffing shortages. We also have the end of the public health emergency, which is creating concerns for those providers that, in particular, that make use of telehealth and other. We were talking about compliance. The easing of compliance under the public health emergency is coming to an end, and each discipline is going to experience different changes going back to where things were before. We also have a new look at what earnings actually are. When the market was, is sailing, the definition of earnings is essentially, what next year is going to look like if everything that we think can go well goes well, and nothing that we think could go bad can go bad. And now it's more like, yeah, we're not going to look at next year. We're going to take a look at this year, and we're not going to necessarily bake in the hockey stick that we were baking in prior to some of the difficulties that we've seen in the market. And then lastly, we have the situation where after many years of high valuations, there's valuation fatigue. That's what we call it, where buyers just like, God, I can't keep paying these high valuations and expect to be able to get out of my investment and make a good return if I continue to pay these high valuations. I'll end this diatribe with the fact that all of these things are pressing down. The good news, and the very good news, is that behavioral health is still by far the most sought after segment within healthcare services from an M&A standpoint. And within that, substance use disorder is second only to mental health in terms of where buyers are looking to focus their energies on. So if one has a really quality operation that's compliant and has all of the niceties involved that create the value, high valuations are still there, but they're not de facto as they were prior to some of these things emerging in the macro environment.
Yeah, I really appreciate that. I remember a couple of years back asking, like, I think we were in Chicago, and I was asking, like why is there so much attention still in SUD? Like, we're seeing, like, you know, decreasing reimbursements, so much more regulation coming into this space. And I remember you saying, like, you know, it's still a very attractive space, even as it is, because there's still so much growth potential there, like compared to some of the other verticals and industries. And I think that even as we continue to mature and have much more data, much more emphasis on compliance, there is still opportunities there. But pointing to that maturity, like, as a mature space and a mature industry, we are going to be affected, I think, by those macroeconomics, right?
Well, yeah, and the you know, one of the things that boosted an already accelerating market is all of the mental health fallout from COVID, and we haven't seen all of that's still manifesting, and so a lot of monies have been allocated in anticipation of some of those needs. Utilization is expected to go up. I think all that's correct, and those folks who are more clinically focused understand better than I that those needs are emerging and are going to continue to emerge as some of that fallout manifests itself.
Yeah, and we're going to definitely chat about that here shortly. I want to ask a couple of questions around that, but first, Tani, let's jump back, and I want to talk quickly about the like some of the deal trends you're seeing, and go back to some of the regulations that you're seeing. What's new on that horizon?
The scrutiny, there is investment interest for quality assets, as Dexter said. We see clients who are opportunistic, and the ones who are able right now are continuing to come into the market, including new investors. The smart ones are doing thorough diligence and looking around the right corners. We see that the corners, including the ones talked about before, largely go into the reimbursement stream. I think that really is central, and I certainly welcome other panelists sort of picking up that thread too in terms of how that's being done. But the quality of your revenue cycle is going to be audited and reviewed. And if you have issues with payers, if you're not credentialed right, if you have recoupments, if you're dealing with a payment flag, or you've had that stuff, then the buyer's going to want to know, is there something unhealthy underlying this all? And payers are aggressive. Payers are opportunistic themselves. Payers talk about buyers, Dexter, being tired of paying high values. I think second to that, or maybe before them, the MCOs are setting their special investigation units to try to claw back money on legal technicalities that we routinely help providers fight back on. But there is certainly a cat and mouse game there. I'm sure Michelle knows a lot about that, and she referred to it. But if you're not able to show that the pieces fit together, then, you know, a buyer is going to say, well, we're not going to be able to support this EBITDA going forward because it's not replicable. There's issues here that we have found. They have to be cleaned out. And if you clean out these things, you may have to give up some, you know, payback money or settle things out. And then going forward, well, how are we going to replace business practice X, Y, or Z? And so certainly a premium in operating companies to do that correctly and have the right piping in place. And then and certainly when you're preparing to do a deal, in addition to all the other great advice that Dexter would give, would be talk to us about preparing to pull together all the information that a buyer and their legal team are going to want to see, so they can check all their boxes. And this great valuation that you have in LOI is going to turn into a successful deal that doesn't get derailed by one of any myriad issues that could go wrong in that space. Too many to talk about here. Also, too many to talk about given the diversity. Behavioral health is a live ecosystem. There are different kinds of behavioral. Dexter mentioned the two of the big ones, mental health, SUD. There's also eating disorders, ABA, IDD. Each of them have their own business practices, payer sources. There aren't one size fits all solutions, but I think among this panel, I think we have some very dialed in people who are probably talking about, and we'll talk about resources that are available to sort of do it right on the go forward, because we do see this as an area worthy of attention based on where the field is and opportunities we have to do it better. And that's good care and that's good business practice, because that's what the payers want to see too. The data supporting this all is why they will choose one provider over another. And, you know, anyways, I will stop the diatribe there, but thank you.
Well, and you bring up a good point, and Christy, I'm going to start with you on this one, but I really do want this to be or open it up to the group, is that this trend that we're kind of seeing is this move towards not necessarily consolidating addiction treatment with mental health, but we're seeing more and more of the co-occurring stuff take place. We're seeing more and more at the facility level, people trying to figure that out, and we're seeing it more at the leadership and acquisitions level, people trying to figure that out. I will tell you from our perspective, starting up a number of these behavioral healthcare entities, we are seeing more and more people come in and they're doing co-occurring, or they're looping or lumping one in under the other. What are you seeing in that kind of that move towards consolidation?
Sure. Thank you. You know, at the Integrative Life Network, we are fortunate that we've got that experience in terms of being dually licensed for both substance use and mental health. I think what we've seen though is new people coming in into the space that were typically substance use focused, which of course a large percentage of those clients do struggle with mental health issues. It's when you take it up a notch and you say, hey, I'm just going to take a client that only has, quote, just mental health. What happens is those clients come in and the staff are unprepared. The staff are not understanding what they're going to be getting. Q15s every 15 minutes because they're concerned about, you know, suicidal ideation. It burns out your staff. It creates poor care. So we have seen a number of people come into the space and you know, there's some question about, you know, do they have the experience and are their staff ready for them? Number one. I think the other challenge you have is that, you know, that had been brought up in terms of compliance and state regulations. It's fascinating to me that payers and different state requirements have different expectations, how you treat substance use versus how you treat mental health. You can't bring them together. Well, what do you do if you have them? You have both, and we don't know yet, you know, is it the chicken or the egg here? So it does create a complex issue. I don't think that payers, nor do I think that the state regulations have caught up with the issue. And I do think that all of us are going to have a lot of work to do, as you mentioned, with COVID. Not only are our clients needing more, but our staff need more. And we are seeing a high number of our staff are struggling with mental health issues themselves. Relapse rates are going up. I mean, it goes on and on.
Yeah, I'm definitely going to circle back on the staff and team member issue, because that's something that we're definitely seeing flood in. But I'd love to get the group to kind of weigh in on this and on where you're seeing this kind of the waters getting muddied between the you know, addiction treatment and mental health. I see personally, whenever, depending on the way that the facility was originally entering into the market, if they entered into addiction treatment, then I see many times they lean into that first, right? As opposed to like if they first enter the market in mental health, they'll lean into that first. And so I'm going to start, because I haven't heard from Emily yet. Emily, talk to me a little bit about like what are you seeing from a marketing and operations standpoint when you have these operators trying to merge both or trying to navigate those waters?
Yeah, thank you, Glenn. I think from a marketing standpoint, I think I forget who said it, but like the number one, spending the money on the front end when you're in the process of an M&A, et cetera, on compliance, is also having like a really clear brand and marketing strategy. Because when you're merging and whether you're bringing in mental health disorder at currently a SUD program, and or you're bringing in a legacy brand under an umbrella company, et cetera, I think the biggest issue I've seen over the past few years as more and more mergers and acquisitions are happening is just having like a clear brand strategy, and then learning it, because now you're looking at diversifying also the type of client or patient you're bringing in, and really being clear about how you're going to do that and diversifying how you're going to do that, and not putting all your eggs in one basket. I think the thing that I've seen is that a lot of the times the spend has been made, let's say, on the compliance, but then they might come to someone like myself and say, okay, we want to do this. And then there's really not been a lot of thought towards like, how are you going to kind of sort out all the different brands, as well as the types of services you're providing, and how are you going to get clients in correctly. And then speaking to what Christy was just saying, like making sure that on the operations side that they're screening these clients, because now they're offering a service that maybe they weren't offering before. And so now then you're again going to be pulling on your staff. So it's kind of this very strong ecosystem of really understanding like the total attribution from once they come into the, they, come in and want to seek help, all the way to them, being a part of the actual operation.
Well, and something else that's really important to note relative to this discussion is that there's such a significant movement for various different entities to take on populations on a per member per month basis. And a lot of these folks are now adding behavioral health services under that umbrella. Once you're in that type of a situation, now the payment is coming directly to a convener or to some other entity, maybe being directed around a primary care physician. And they want to be able to go and say, I have somebody with a mental health or a behavioral health issue. I'm going to go to company X. And if that company can handle multiple services within the behavioral health arena, that's going to be a very, very favorable partner within that ecosystem. And that ecosystem of population-based services is where so much money is being directed today. So that change, that's a game changer, because now everything, you're taking away the government payers. The government payers are just a financing mechanism. And now you've got, let's take care of the person as a whole. And once we start taking care of the person as a whole, the boundaries between medical, physical health and mental health break away. And then the barriers within behavioral health begin to break away.
Yeah, and I think I want to just touch on another point to speak to that. And I think Christy, you probably understand this, and Ben as well, is that as you bring in many different companies and or under an umbrella, et cetera, you also have the issue of like all the different systems that they bring with them, right? Very individualized systems, whether you're talking EMRs, you're talking CRMs or revenue cycle management systems. And it's almost like there needs to be this whole other side of this industry as well to kind of help sort all of that out, because everybody wants it to be, one universal system, but trying to kind of sort that out, that seems to be another challenge, I guess, a barrier that I've seen in terms of trying to help people, brand themselves or market themselves appropriately, is once you kind of get under the hood and realizing how many different systems there are too, and working with the operators and the various leaders to make sure that it can be as streamlined of a process so that there is no barrier to entry for that person seeking help and needing the help. So I just wanted to kind of bring that in as well.
100%. Ben, I want to ask you this, because like that is my biggest question, seeing the move with Kipu Avea coming together, seeing like how you guys are doing that integration, and not just a technology integration, but then integrating between mental health, co-occurring, all these other different ways. What are y'all seeing on that? And how can you speak to that?
Well, I think it was pretty interesting. There's 4 of us, Michelle, Dexter, Connie, and I were at the BHB Value Conference last week. And one of the big highlights was interoperability. And especially when you start talking about integrated care, I mean, the payers who have, deep pockets, basically, they just said it's a nightmare. And then as you start bringing in these different digital tools, they said, okay, we're in the first inning of a very long baseball game that's going to go extra innings. So from our standpoint, we look at, I mean, integrations, it's very easy to say something's integrated, but the right integration is a whole different story. So like whenever we look at internally integrating between the two platforms, it's a long process. It's, you know, and as we start looking at outcome measurement tools, how do we integrate with them? It's not just saying, okay, we're going to send data back and forth, but how does it impact the clinical workflow? You know, is it people are getting so many tools thrown at them, and there's almost an overload from a clinician standpoint that I have another system I've got to be working with. So for us to turn around and go, how do we build this into the workflow from an EMR standpoint? Do we make it easier for them? Is the data being pushed back in? Is it actionable? And then also, if you get the clinical adherence, you then need to think about the patient adherence. So, you know, it's not just, okay, now here I need you to set up a separate account. We need to connect those two accounts. So us really having that handoff is important. But I think it takes a collective group. It's us working with, you know, all the different vendors in the space, other EMRs. You know, we see a lot of consolidation happening. We've got groups that right now we're integrating. I mean, they've acquired 10 different EMR systems and now want to consolidate into one. So imagine pulling that data in, consolidating it. So yeah, it's definitely something that's in the forefront. But what I like to see is I like to see that we're talking about interoperability. We're talking about interoperability plans. So.
Ben, I know at Integrative Life Network, we certainly have had that experience from going, you know, when I think of all the different diagnoses that we treat, from eating disorders to substance use to trauma, mental health, and from an in-network, out-of-network, cash pay, all of it combined, it is challenging. And one of the things that we had to really adapt very quickly was making sure that we did have an acquisition or a de novo plan, and then how those plans, there's nothing that's ever set in stone, right? It's always being adapted and changed. And then bringing in a very strong director of integration, because your point is well taken. That's part of our due diligence process, is simply to ask, what's the EMR system again? What's the CRM system? Do they have a CRM system? Do clinicians know how to use them? You know, those are the things that we're asking on the front end.
Yeah, and that makes so much sense. I mean, you know, even something like as simple as Salesforce, you know, that drop-down list on an insurance payer has to feed through other systems and ultimately your billing. And so taking the wrong information at the front end from an eligibility standpoint, or when you're dealing with authorizations, dealing with carve-outs, all of that stuff has to systemically flow. So.
Yeah, I know it's a huge pain point for us, and you know, Emily, we're gonna shake our heads because when we do the same thing, we come into an operation that's grown through acquisition. Sometimes we're dealing with multiple CRMs and trying to weave through all of that tangled web to figure out lead attribution is it's a huge challenge. It really is. We're going to run, we're running close on time here. I do want to take and talk just really briefly. And Christy, I want to throw this to you to kind of talk in senior living. When I'm playing in those circles there, I'll tell you, staff attraction and retention is the number one thing on their radar. And fortunately, in substance use treatment, we have you know, we haven't had the same pain points that they've had, but I'm starting to see that more and more. And all of the integrations, all the things that we've talked about today are reliant on people. And so talk to me just briefly for a couple minutes about, like, what are you seeing with that a challenge in substance use treatment with attracting and keeping our team members?
Sure. Yeah. I mean, I think we've all heard about the Great Resignation, and we all paid for it, right? All the pay increases. And of course, in our situation, I think what I found ourselves into is some pay inequities, and we had to reset, of course, and then, you know, your margins are affected by that. But, you know, from quietly quitting to now, I'm hopeful with that, what they're calling now the Great Regret. So, you know, it's having some acceptance, particularly for the lower cost employees, that there will always be turnover, but being really clear on what are you investing in. If you're thinking of, hey, this is the time, I would say it is the time to invest in training of staff, having a real clear plan for growth. So, we've been able to add in layers, for example, to ensure that our staff can come in and find a career path with us, because frankly, they can make more money in private practice. Most people come to this field though, because they want to be part of something. They want to give back. So it's really never about the money per se. So you have to really lean into making sure that the environment that they're working in is something that they feel part of and that they're encouraged by. If the mental health and the stress is high, what can you do to reduce that? We're very fortunate at the Integrative Life Network to keep our caseloads very, very small. And while it may cost us something right now, it's going to cost us a whole lot more if we start having a walkout of therapists. It's just too hard to find them.
Yeah, I really appreciate that. It is such a challenge because at the end of the day, in our industry, whenever we're talking about working with people that are struggling with substance use disorder, it is about that connection between the clinician, the person that is providing the care, and the person that needs care, and it's vital. I like to call them magicians, and it's so hard to find good magicians. It really is. So I appreciate the focus on that. It's such a challenge. For the sake of time, what I'd love to do is every one of us comes from these different backgrounds and have these different areas of expertise across the space. And what I'd love to do, and if you're out there watching, this is your note-taking time right now. So get your pen and paper together. I want everybody here, we're going to go around the room and just give like one thing that is so important to you that you would love for the audience to know, to be able to take away from this. And Michelle, I'm going to start with you today. All right. So you're going to kick us off. And so you got a couple of minutes here to kind of just impart your knowledge and give that to the people that are watching today. And then we'll move on. So Michelle, what you got?
So some takeaways, right?
Yes.
Yeah. So first of all, I really appreciate the questions in the chat. Sounds like a lot of people are having some of the similar challenges. This is really resonating with people. So just wanted to reiterate that what Glenn said in the beginning, that if we can be able to answer, if we can answer questions in a different forum later, I'm happy to do that. I would say some takeaways. Dexter really talked about the macroeconomic impact, and we heard about how this is affecting deal making and whatnot, and valuations. I would say this is a great opportunity for providers and facility owners and those who are thinking about entering into the space to really think about the patient responsibility aspect of sort of the revenue cycle, where the money is going. Historically, about 5 to 7 years ago, we saw allowable rates from insurance companies significantly drop. And now we've seen those rates kind of stabilize, what facilities are getting reimbursed. But what has changed is the patient responsibility aspect. So especially for out-of-network coverage, when, as the patient the amount that the patient is responsible for increases, that really impacts the bottom line, especially, in sort of when you look at a total patient population. So this is really just resulting in the greater need for cash to become, for facilities to have cash available as they're, looking at having a sustainable revenue stream. I'd say what's trending is, you've heard, we all know now, we need data-driven decision-making. But I would say the two takeaways would be prudent risk management, really pay attention to the compliance and what is required and stay on top of it, because as someone mentioned, it's easier to do it as it comes versus waiting for an audit and then having to gather everything at the last minute, which we're all kind of prone to doing. So really staying on top of that. And then long-term planning and responsible financial stewardship. So I think, we've always been paying attention to smaller margins, and as a result, kind of looked at that maybe the immediate to 3-month trajectory of our facilities and of our businesses, but we have to start looking at the long-term planning and really making sure that the financial stewardship is there, especially if we're thinking of some sort of deal in the future, but really just having the cash to manage our operations.
Wonderful. Thank you for that. I appreciate it. All right, Tanya, you're up.
Oh boy. Thank you, and great to be here with everybody. There's so much that could be said, but the maybe thing that, for having been in the space for a while that jumps to me is that 15, 20 years ago, I was in-house at CRC Health Group, and Barry Carlin had the vision to create outcome tracking and telehealth, and the company did that. It was way ahead of its time. Nobody wanted therapy through a computer terminal, and there was just no way to stack data, the tools. It just wasn't the right time. It wasn't the, I mean, it was the right thing, not in the right time. Here we are in 2023. It's the right thing. The revenue payers, it's about where the opportunity is to develop strong relationships, to figure out value-based care, to make a robust, attractive, differentiated quality offering that's financially sustainable for your organization, for the patients and the other stakeholders. You need to do it. The pandemic has changed everybody's thinking about telehealth. The regulations are obviously adjusting, and everybody's got to find their way through it based on their entry point. But that plus the quality, and I know I take Ben's point about systems, you know, one more system to throw at clinicians, but I think organizations that leverage technology to wrap this all together, the right solutions to use the power and now more cost-effective tools to do things like make these systems work and find automated ways of doing things that used to be manual. A very neat company called Hatch Compliance, Mike Lifshot's a good friend of mine, is like they figured out a software-based module that will measure your piping and make sure you do it. That's cost-effective ounce of prevention stuff. And I think there's this convergence on all these strands that smart providers can take advantage of to address the things that'll make the sustainable organizations and attractive and relatively pain-free deal processes that we M&A professionals have. That's my take.
Appreciate that. All right, gonna throw it to Emily now. Emily, you're up.
Great, thanks, Ben. I think my big takeaway for everyone would be, you know, to really have, like I said, a strong marketing strategy, especially if you are going to be merging with other organizations and or creating an umbrella brand, and or if you're going to be adding additional services like mental health, and really understanding what the overall strategy is, not only operationally, but how you want to market what you are providing. And then with regards to lead attribution strategy, make sure that it continues to be a diversified strategy. So it's not black and white in terms of like all business development or all digital, all alumni, et cetera, really diversifying it, knowing kind of how challenging the space is and how competitive it is. And also really remembering that, like, unfortunately and fortunately, their money does have to be spent on the marketing side in order to achieve the revenue goals. And as part of that, in order to like hold all parties accountable in terms of, you know, for patient attribution, is really making sure that the systems are aligned internally so that it has the good data to show, you know, successes, revenue goals, et cetera. So really streamlining those systems so that you can have the data and the outcome data.
Right on. Thank you for that. All right, Ben, you're up.
All right. I'd say make sure that the systems that you're aligning your organization with have the right technology strategy on combining data. The other piece is really when it comes to revenue cycle management. As we heard last week from the CEO of Optum, it used to be you could be allowed to get higher rates. Now you have to bring data, and you're seeing that more and more. So I think it goes back to operationalizing data, and then, as I mentioned, harmonizing data.
Right on. Thank you for that. All right, Christy, your turn.
I would say invest and take care of your staff. I mean, you know, you could look at having a robust clinical development program. That's going to decrease your turnover. It's going to increase your client care. It's going to increase your outcomes. And remembering that data management also is very important, being able to manage by data, but also we're relational. We're relational in the work that we do. Do not forget that. It goes back to taking care of your staff. And lastly, to piggyback off of what Emily said, is that, you know, it's one thing to know what you're saying yes to, but you need to know what you're saying no to.
Yeah, absolutely. Love that. Thank you for that takeaway. All right, Dexter, your turn. You got it?
Sure, thanks. Real quick, it's so critical. I would really strongly recommend that everyone invest in bringing outside people to examine your issues around compliance. And more importantly, going into that with the idea of hoping that they find something. Because what you really want, you want people to find what you can correct. And once you find those things that you can correct, the value that's returned to you from ongoing risk management all the way through the possibility of maximizing a purchase price later on down the line, I can't begin to tell you from real live experience the return on investment that you can get on doing those types of things well in advance of thinking about any kind of a transaction.
Outstanding. Thank you for that. And Bethany, you're going to wrap us up here. What are kind of your last thoughts here to leave the audience with?
Sure. So I hate if I drop the ball and I don't have huge insights, but I don't want people to walk away from this without thinking about how you're part of a collective. So we're certainly all concerned about our patients and our sites and our data and our programs, but we can do more collectively together. And you'll hear me, I'm a giant data nerd. I'll talk about data all day. But what I want to remind folks is that data doesn't do anything on its own. We get data and we get to do things with it. So you're already collecting data, you're collecting your outcome measures, you're tracking your financials, you're already collecting all of that. So you get to start from a really empowered place. And if you can find ways to connect that to others and to collectives, then maybe we can start to tear down. I saw a panelist in the comments mention like a Tower of Babel. We can start to speak the same language and have conversations that make sense across all of our different spaces. And that will help elevate the field as a whole. But that's only possible when everybody buys in and works on it together. So I'm so excited that so many people are here and interested and engaged, and it makes me really excited and proud and hopeful, even though the challenges seem really big.
I really appreciate that. And just briefly, while we have a couple of minutes here, could everybody please put your and I mean all the panelists, do you mind putting your emails in the chat for the attendees? If you guys, I encourage you, if you didn't get a chance to ask a question or answer, we didn't answer the questions today. I know we hit on a lot of topics. Please reach out individually to the presenters today and their area of expertise and continue the conversation. This whole forum is really just that at a high level. It's to make sure that we start the conversation. It's not the end of it. And make sure that we're looking at the whole picture here as we continue to move towards the maturity of the industry and move towards best practices. I just think that the fact that we are all here having this conversation, bringing all the different aspects together, really does speak to that as an industry, that we are moving into a much more organized place and a much more mature place as a field, as an industry. And at the end of the day, when all of us are working together, the patient does benefit from that. You know, that's really what it boils down to. I'd like to thank everybody for being here. Thank you all for participating and bringing your areas of expertise. Please, I look forward to seeing everybody at the events coming up to continue this conversation. If you have a question for any of us, or you didn't get a chance to ask a question, you can email me at ghadley@dreamscapemail.com, and I'll make sure to get it to the appropriate person. And with that, just want to thank everybody for being here and being a part of it. And we'll do it again. Thank you guys so much, and enjoy the rest of your week.
Thanks, everybody.
Thank you.
Thank you all.
Hi, everyone.